So without further ado, I would like to welcome the CEO of Lexaria Biosciences Corp. Please welcome Chris Bunka.
Thank you so much. Hopefully they'll get my mic turned on, or I'll be here all the time. I am going to talk about Lexaria. I'm going to talk about science and edibles and all sorts of different things as soon as they get my... Not up here. There we go. Thank you. I'll tell you what I'm not going to talk about. I'm not going to talk about asking you to choose a brand. I'm not going to ask you to choose a growing technology or a delivery.
Walk up close.
Side of the fact that Lexaria came at this a little bit different, and we just said, you know, no matter how you grow it, no matter what you do with it, it doesn't do you any good unless you get it into your bloodstream. And that's what we do. So our technology is developed in-house completely. We received, we filed our first patent applications in 2014. I'm going to tell you why that's really important. And I'm going to talk about the 4 things that our technology has been proven to do, which is it masks unwanted taste and odor. It improves dramatically the speed of onset. It increases dramatically the bioavailability. And I've heard that word used, and I've heard that word misused a lot. And it's incredibly simple and cost effective. So our technology can be applied to any number of different consumer products or pills or beverages. But if you have 2 employees in the room about the size of a double garage and a capital budget of less than $10,000, you can implement our technology in 25 to 50,000 servings per day. Not expensive. You probably know that Lexaria is one of the most intellectual property heavy companies in the industry in the world. We have 53, I believe, patents pending right now. We have 10 granted. Actually have 10 patent families now. And we have method of use and composition of matter patents, which means we own recipes, if you will, and we own processes. And in the idea that size matters, well, time also matters. Lexaria was beating the drum pretty aggressively back in 2014 when nobody gave a damn at all about IP. And the only thing that anybody talked about in Canada was how many square feet of growing space you had. All right, well, that's a metric. But not only does the quantity of patents that you have matter, not only does the quality of patents that you may have or have filed for matter, but the date upon which you filed your patents really matters. So if 2 companies come along and they have more or less a similar idea, that happens a lot in the world, and one company files their intellectual property claims at a particular time and date, and another company is 10 minutes behind them, literally, the first one there wins, and the second one gets 0. That's the way the U.S. Patent Office works. We have 53 patent applications right now. We expect that number will double or triple over the next couple of years because of all the work that we're doing. Another thing that makes Lexaria very different, I've heard a lot of companies compare themselves to Lexaria in the last year or 18 months, and I'm very flattered by that. I think that's because we've done a good job. But I don't hear them much talking about this. Our technology was developed by and for the cannabis industry. And it's really ironic when you think of all the social justice issues and the criminalization issues and so on associated with cannabis. However, we now have patents granted, not just pending, but patents granted for the delivery of vitamins, NSAIDs, which are non-steroidal anti-inflammatories like ibuprofen, and nicotine, as well as for cannabinoids. And in fact, some of the patent filings that we have been making in 2017 and 2018 have come directly as a result of some of the clinical work that we have done in Europe and Canada, and the United States, which has, quite frankly, led to some pretty profound discoveries. We are different because I don't know of any other delivery technology developed in the cannabis industry that's being used in other industries such as these that you see here. And in fact, last December 2017, we received our first patent for the delivery of nicotine. I'm going to talk more about that in a moment. Bioavailability. Boy, that name and that word is just so misused. There's only 3 prominent ways to get cannabinoids or most drugs into your bloodstream. One, you can inhale them, pulmonary absorption through your lungs. It's typically a 30 or a 40% success rate, i.e., if you have a milligram of a drug in a stick of tobacco or a stick of cannabis, 30 or 40% of that milligram will typically enter your bloodstream. It can be higher. Sublingual, under the tongue, is usually a 15 or 16% rate of absorption into the bloodstream. And oral or gastrointestinal is very, very low. It's usually 4 or 5% for a lot of fat-soluble drugs. And that is what we are all about. So this year, instead of talking about it, instead of asking you to believe things that may or may not be so, we actually performed a human clinical trial in Europe at a medical university. This was a double-blinded, randomized trial. And we used 90 milligrams of a product that we have formulated, Turbo CBD. And we discovered that, lo and behold, just as we had expected, we delivered 317% more CBD into human blood in 30 minutes than the same batch of the same oil in the same recipe that lacked our technology. And as you can see from the curve, the area under the curve, we are roughly double the amount of CBD. In other words, when we say that our tech works, our tech works. We've done a number of studies, human, animal-based, and in vitro-based. Trend away from smoking. Come on, we've had this conversation for 40 years. We know that smoking is not okay. Smoking cannabis is nowhere near as harmful as smoking nicotine, but it's not harmless. I was at a lot of you may have been at the cannabis event in Las Vegas last week. I attended an after party where everybody was smoking and vaping. And I had to leave the room many times because I have asthma. And nothing to do with your social acceptance or not, and nothing to do with whether or not I'm smoking it. I can't be in the room. And there's a lot of people who have issues like that. So smoking is not okay. And in 2014, by the way, that was a little while ago, we put onto the market our first cannabis beverages, which really made me chuckle when about a year ago that little company Constellation did that little deal with that other little company Canopy, and they're talking about beverages and can we do this and can we do that. We've been doing that for over 4 years. We have a lot of experience in beverages and we have a lot of granted patents. Our business model is one of royalties and sales. We license our intellectual property around North America and the world. And I want to talk briefly about nicotine. Because our technology is patented for the delivery of nicotine in edible forms, nicotine is one of the biggest industries in the world. It's $1 trillion industry today, not projected. It kills 6 to 7 million people today, not projected. That is real, and for every person who dies, 30 more are hospitalized. It's a much bigger and a much more profoundly important market than is cannabis, quite frankly. We are working hard on advancing the discussion among forward-thinking and talking adults about nicotine use. We have conducted some animal studies on nicotine this year, and we delivered more nicotine into the blood more quickly, again through edibles. We actually used our technology, mixed the result into water, and squirted it into the stomachs of rats so that there was no possibility of absorption in the mouth or the throat. And we had some pretty amazing numbers, including when we finished the test, taking liver, kidney, and brain tissue samples, we actually discovered that our tech had 560% more nicotine in brain tissue, which led to a couple of our most recent patent filings, which I can't go into for too much detail for obvious reasons, I would think. We think this is very, very profound, and I've said this publicly before. I'll say it to you here again in Toronto. Once we published these results, our telephone rang a lot, and we spoke within days and weeks to most of the largest tobacco companies on earth who were wondering how we did what we did. And I can tell you that in discussions with their chief scientific officers all over the world, they have intimated to us that they have not themselves been able to reproduce that or to achieve those kinds of numbers. I'm not trying to say that everybody should be using nicotine. I'm trying to say that if you're a smoker and you're trying to stop smoking, why not take nicotine in a format that will not give you cancer? Because nicotine taken in small doses, non-inhaled, is not known to cause cancer. Our team, we have John Doherty, who used to be the president of Helix, well known here in Toronto, who is a pharmacologist, toxicologist. We have Dr. Ergenzinger, who has a PhD in neuroscience. We have Dr. Ainsley, who is with University of British Columbia, head of their cardiovascular department, and we have a lot more. We also have been public a long, long time. We've been at this a long, long time. And one of the things I'm proud of, I do not stand up here in front of you today with 1 billion shares in our market cap or more. We have 77 million, I believe, today, and that's after 5 years of operations. I am the biggest shareholder. Our management team holds a large position. And that's all I've got. I know that we don't have a lot of time, so I'm going to keep it short. Thank you so much.